Chapter 1, Video 3. Now we're going to talk about the 5 rights of delegation. When we talk about the 5 rights of delegation, I would like for you to see the table 1-4, and I want you to know this table. There are several questions on the test that are going to come from the 5 rights of delegation. The first question that you're going to ask yourself before you delegate anything is this the right person? Is the nursing assistant that I'm delegating this to trained? Okay, so step 1 is this the right person? Step 2 is, question 2 is the right circumstance. Is the patient's condition stable? Should the nurse do the task herself, or should she delegate this to the nursing assistant? Question 3 is the right direction. Can the nurse give clear direction, and can that task be delegated? Question 4 is the right task. Can the task be delegated? Does the nurse practice act allow that this task be delegated? And then question 5 is the right supervision. Will the nurse be available to supervise and answer any questions in the event the CNA or the nursing assistant has questions? An example of this would be the nurse asks the CNA to remove the Foley, but she waits until she returns. So the CNA, maybe the nurse has to leave the floor, and she asks, I'm going to step off the floor for a minute. If you could go remove the Foley. That CNA shouldn't remove that Foley until that nurse comes back to the floor and is available in the event that she or he has questions. Before delegating any task, that nurse should consider the 4 major factors. We need to look at the state laws and standards for practices for nurses in your state. We need to look at the ability of the nursing assistant. We need to follow facility policy regulating the duties a nurse may delegate to a nursing assistant, and we need to assess the patient's condition. We need to make sure that we feel like that patient is stable enough that the nursing assistant can actually handle the task. When a task is delegated by the nurse, the nursing assistant is responsible for A, recognizing which tasks are within her scope of practice, B, knowing her range of abilities, C, knowing what is in the nursing assistant's job description, or D, all of the above. In this question, the correct answer to this question is going to be D. The nursing assistant should consider all 3 things before accepting a task. As we move forward, we're going to talk about communication in the advanced care setting. Communication is critical for every healthcare worker. So with that being said, nursing assistants are often the ones in contact with the patient more. So the nurse may be sitting there at the nurse's station. She may be reviewing doctor's orders. She may be reviewing records and getting prepared to administer medications. But that nursing assistant is in there with that patient one-on-one. That nursing assistant is in and out of that room daily taking care of their physical needs. If that nursing assistant comes to you and reports that he or she is having issues, that the patient may be having some issues, or they've experienced a change, it is very important for that nurse to listen to that CNA or that nursing assistant, because they watch the patient decline, I guess you would say. So if they went in the morning at 8 o'clock, Mr. Jones is alert, he's oriented, he's talking. They go back in at 8:30. Mr. Jones acts like he's a little bit sleepy, but by 9 o'clock, 10 o'clock, he can't keep his eyes open, and he's a total different person from what he was when she walked into the room. So this nursing assistant is with that patient, and they're seeing that change. And if they come report a problem, it's very important that they know to report the problem. And not only do they know to report the problem, it's important that the nurse listen to the problem. So that's an example of that. There's factors that affect a patient's ability to communicate. A patient may not be conscious. That doesn't mean that they can't hear you because they're conscious and they're not responding. They could possibly hear every word you're saying, but something has affected them and they're unable to respond. The person may not be able to speak as a result of a stroke, a head injury, or a medical condition. They may have a breathing tube or a mask over their face or mouth. They may be in severe pain. All of these are factors that could affect your ability to communicate with the patient and the patient's ability to communicate with you. With that being said, we need to always explain what we're doing to the patient. If that patient is unconscious, we still talk to that patient. We still communicate with that patient. Mr. Jones, my name is Kendra Anderson. I'm going to be your nurse today. I have to start a new IV on you. So I'm going to be touching your arm and you're going to feel a slight sting as I put this IV in. Let them know whether or not they can respond to you. You still communicate with them what you are doing because you don't know whether or not they can hear you or they can't. Other ways of communication, you may have a patient who is aphasic from a stroke. They're not able to talk and, they're sitting up in the chair, but they're not able to communicate with you. Or they can't hear you. You may be put in the position where you need to write things down so the patient can read it. You may use a picture board to point to the picture. You need to also look at their body language. Do they look like they understand? Are they nodding their head yes or no? Do they look confused when you talk to them? So definitely observe body language. Another thing, you may look at body language and be able to tell if you think the patient is experiencing pain or not. If they're not able to talk to you, but when you go in, you can see them gritting their teeth and making faces, that may indicate that they're in pain. Or if they're favoring an arm or a leg or favoring a limb, these are things that could help you determine if they are in pain or not. If they're wearing hearing aids, we need to make sure that they have their hearing aids in before we start talking to them. If they don't have their hearing aids in, then they definitely can't hear what you're saying. Also, when we're providing written materials to patients, we need to make sure that they have their glasses. They may be sitting there, they forgot to put their glasses on, and we give them written material, and they're trying to look at it, but they don't have their glasses on, so we know they can't see it. But one thing that I do want you to look at is table 1.1 and be familiar with that. Question. When a patient is unable to communicate, the nursing assistant should ignore the patient, only communicate with the patient's family, not observe body language, or use alternate ways to communicate, such as picture boards. And this is the correct answer here is going to be D. We need to use alternate ways to communicate. There are different devices that can assist the patient to communicate, such as a notepad, pencil, picture, boy pointer, etc. So please make sure that you are using alternate ways to communicate. For your first test in AHS 110, guys, I'm going to need you to review the lecture. You're going to need to read the chapters. You're going to need to know the chapters in detail. If you have questions, please feel free to let me know, but make sure that you read the chapter and you break down and highlight the things that I went over, but I would read the chapter and go over all the tables in full detail. These questions are critical thinking style questions. They're not definitive based. So you're going to be given an example when we're talking about the 5 rights of delegation. You're going to be given a scenario, an example, and you're going to have to choose what it falls under. Does it fall under step 1 of the 5 rights of delegation, which would be, hold on for just a second. Does it fall under step 1, which would be the right person? Does it fall under step 2, which would be the right circumstance? So on and so forth. So you're going to be given a scenario, and then you would have to choose which of those 5 rights of delegation that would actually fall under. So it's not definitive based. It's going to be critical thinking based, but you need to go through the chapter and you need to get a good feel on everything that we went over and read the chapter good. And when you come across questions while you're reading, please don't hesitate. Email me. I'll be checking my emails frequently. And if you have questions, put them out there and I will be back in touch. Thank you and have a good day.